My name is Allison McMillan, and today I'll present in a discussion on the different groups of medications used to treat pulmonary arterial hypertension. Let's review pulmonary arterial hypertension, also known as PAH. PAH is a disease where there's an abnormal elevation in the circulation pressure of the pulmonary artery. Diagnosis is made when the mean pulmonary artery pressure measures at 25 millimeters of mercury or higher. The golden standard for diagnosing PAH is through a right heart catheterization. In PAH, you're going to find the enlargement of the right ventricle. You're going to find hypertrophy of the ventricle wall. You'll also find thinning of the pulmonary arteries leading out of the pulmonary artery. And finally, you'll find a thickening of the cell wall on the pulmonary artery, which decreases blood flow to the lungs. There are three pathways that are targeted in the treatment of PAH. The endothelin pathway, the nitric oxide pathway, and the prostacyclin pathway. Endothelin is a vasoconstrictor and promotes cell proliferation, so the medications here work to block the production of endothelin. And nitric oxide release helps with the relaxation of smooth muscles, which helps to dilate the vessel and inhibits cell proliferation. So these medications target to increase the production of cyclic guanosine monophosphate, which helps to produce nitric oxide. And then finally, you have your prostacyclin group. Prostacyclin is a potent vasodilator. It has anti-proliferative, anti-inflammatory, and aggregation inhibiting properties. It does have a very short half-life, so the medications here target to prolong the time that the prostacyclin works in the body. The endothelin pathway medications, there's three oral medications, one of which is this one, Letairis. They're all oral. They can be taken with or without food, and the goal is to slow the disease progression and improve the ability to exercise. And when we say exercise, it's really like ability to do daily life activities such as walking up and down stairs or taking a shower. Some side effects with these medications include fluid retention in legs and abdomen, respiratory tract infections, inflammation of the sinuses, abdominal pain, flushing of the skin, decreased sperm count. For women, it's contraindicated to get pregnant, and use of birth control can be affected by these medications. And also should not take if you are on a cyclosporine or glyburide. The nitric oxide pathway medications include sildenafil, Revatio, or Viagra, tadalafil, which we have right here, and these two. Again, all of these are oral medications. They have many side effects, but the most common ones are nosebleeds, heartburn, headaches, upset stomach, worsening of shortness of breath, nasal congestion. They must be used in caution with those that have low blood pressure or take nitrates, because together they can lower blood pressure, which can cause the patient to have loss of consciousness or even death. And then we have the prostacyclin pathway medications. These are IV or sub-Q and also inhaled versions. This is an example of the medication used to deliver Tyvaso, one of the inhaled medications. Goal of these medications is also to increase the ability to exercise. Side effects can include headache, diarrhea, nausea, jaw pain, flushing of the skin, dizziness, muscle joint pain, and increased cough and GI irritation, especially with the inhaled version ones. Finally, what do these medications mean for the lifestyle and environment of the patient? First, distribution. You can't get it at your local pharmacy. You have to get it delivered by a specialty medication pharmacy, pharmacy. Cost, these medications cost a lot of money. Insurance can cover the cost of the majority of it, and then the rest of it, the manufacturers have patient programs to help. And then the ability to learn. It's learning how to use the machines for the inhaled, the IV. There's a lot of patient learning involved. And then finally, the frequency of the medications. Some of them are just once a day, but like the inhaled one, the patients have to take it up to 4 times a day. So it was a brief but quick discussion about PAH medications. I hope you were able to learn just a little bit. Thank you.